Zoe. I'm going to be your nurse today, and you have an order for a nasogastric tube. Alright, and I'm just going to check your name. Can you tell me your name and date of birth? Okay, good. Everything matches. Nice to meet you, Mr. Smith. I hope we're doing well today. With your nasogastric tube, it is to ensure that you get enough nutrients. And the way that it works is it goes through your nostril, down your esophagus, and into your stomach. And this ensures that you also get medicine too if we need to put it in through your nasogastric tube. I'm going to place you in high Fowler's position. That way we have a smooth insertion. We're trying to make this as comfortable as possible. Alright. Move over to the over. I'm going to take this pillow. Do you have any latex allergies or any allergies? And have you had any nasal surgeries in the past? No? Good. Okay. Now I'm going to take this pillow from behind your back. That way that you can tilt your head back. Now I'm going to place this over you. That way we don't soil your gown. Okay. We're also going to put this basin right here just in case you feel nauseous. Have that there for you, and we'll need to use this later. Now while we're doing this procedure, just let me know if you have any difficulty swallowing, talking, if you experience cyanosis. Alright. And if you do feel any of those, then we will immediately stop the procedure. Okay, so this is the tube that is going to be inserted. So we have to measure it from your nose to your earlobe, and then from your earlobe down to your xiphoid process. Just want to ensure that we have it accurate. There we go, and now I'm just going to mark where we need to stop. Okay, good. And now we need to make sure that the end of the tube is lubricated. About 2 to 4 inches, and this allows for a smooth insertion. Okay. Alright, Mr. Smith, so now we're going to check to see which nostril is appropriate for the insertion. So if you will, just breathe in when I touch this nostril. Good. And breathe in the other one. Good. So it does seem to be that your right nostril is the clearest. Okay. And we are about to be ready for insertion. So now when I go in to your right nostril, I'm going to ask that you tilt your head back. And as soon as we reach any resistance, I'm going to ask that you swallow some water. Okay? Okay, if you will, tilt your head back for me. Here we go. Good, good. And we are reaching some resistance, so if you will, swallow some water for me and just tilt your chin to your chest for me. Alright, now swallow. Good. In normal circumstance, the tube would go all the way to the part that I marked. But since this is a mannequin, it will not reach all the way that far. So we are going to simulate. Make sure that the tube stays in a position. We are going to secure the tube to the bridge of the nose. Okay, Mr. Smith. Now I'm going to peel this back, and we're going to take the rest of the tube to your gown and leave some resistance so that you can move your head. Alright, the hard part is over, so now I'm going to take this and throw it away. Now we are going to take your x-ray to make sure that the tube is in correct placement. And once they identify where the tube is, they will take the wire out and begin your feeding. Alright, we'll see you in a little bit, Mr. Smith. Hey, Mr. Smith, it's Zoe, and we now have an order for a nasogastric replacement. You're going to take out your nasogastric tube, which I'm sure you're glad to hear. Okay. So now, if you will, tell me your full name and date of birth again. Alright, everything matches, so that's great. Alright, we're going to take this cloth and make sure that you don't get anything on your hospital gown. We're going to make sure that you're dry. Alright, and here is this basin. If you start to feel nauseous, you're free to use it. Now, this procedure is not as uncomfortable as the last one. Alright, so when I take this tape off of your nose, you will take a deep breath in and then hold your breath, and then we will take it out for you. Alright, so now if you'll breathe in for me, tilt your head back and hold your breath. Very good, Mr. Smith. Yep, that's it. Alright, let me clean you up right here. You're going to throw this away. Put your pillow back, make sure you're comfortable. Oh, watch your head. There. And now we're going to put you in a comfortable position. It was very nice working with you, Mr. Smith. And I hope you start to feel better very soon. Thank you.